Can you say baby hippopotamus now?
Maybe hippopotamus.
No. Okay.
Maybe hippopotamus.
Touch your nose.
So far, it's not looking good. After receiving the stroke medication, Bruce appears to be going backwards. 62-year-old Bruce is having a stroke. His blood pressure has gone through the roof. It needs to drop before he receives clot-busting medication.
With one of your fingers, can you touch my finger? Yep, touch your nose.
So far, it's not looking good.
That's it, and out to my finger again. That's it, beautiful, put it down. Can you say baby hippopotamus for me?
Baby hippopotamus.
Can you tell me what happened this morning? Should we go around the
I
scan?
was about to get ready to go to work, and then I went to feel a bit of it, and I right home just said, no, we'll strengthen this.
Yep.
And then I tried to call someone, I couldn't speak for a while. That's what called ambulance.
Okay.
Less than 15 minutes after arriving, Bruce is already having a brain scan.
What we're going to do is we're going to have a quick look at those scans. We're going to try and get your blood pressure down a bit because it's a bit too high at the moment. So we'll keep giving you a couple of medications and then I'll come back around and talk to you in the emergency department, okay? There are certain types of treatments that we can offer. IV thrombolysis is one of the clot-busting drugs that we can give. The sooner we give that, the better the outcomes are for our patients. So Bruce, so we've finished those scans. There's no bleeding there.
That's kind of a good thing.
That's a
isn't it?
good thing, yes.
Okay, that's a good thing.
But you do look like you are having a stroke, and it looks like it's in one of the smaller vessels in your brain.
But until they get Bruce's blood pressure to a safe level, they can't start treating the stroke.
Your blood pressure's still a bit high, so we need to try and quickly get your blood pressure down, and then we'll give you that medication. Because if we give it to you when your blood pressure's too high, the risks of bleeding are higher. So we need to try and reduce his blood pressure to about 180, because the lower his blood pressure is, the less likely he has a bleeding as a result of the clot-busting medication. Oh, let's go, let's go. We're down. Okay, good to go.
Thank you.
So now that runs over an hour.
That's an hour, is it?
Yep. Yep, so that'll take an hour to go through, and then we'll just try and keep your blood pressure down for the next 24 hours. We'll keep a close eye on you and see how you go.
But after receiving the stroke medication, Bruce appears to be going backwards.
Can you say baby hippopotamus now?
Maybe hippopotamus.
No, okay.
Maybe hippopotamus.
We're going to take you around and do another scan. Okay. Bruce's symptoms have started to return, so he's having trouble saying baby hippopotamus again, and he's having trouble holding that arm up. So we're just going to do a scan to see if he has had a bleed or if there is another clot or something that's happened, just to see if we can see any changes. So Bruce, I know it's all a bit of a panic and we're worried about you bleeding in the brain. I think what's happened, watch that line. Yeah. I think what's happened is we've dropped your blood pressure too low and your brain doesn't want it that low, and that's why these symptoms are coming back.
Bruce, how are you?
Yeah.
Can you say baby
hippopotamus?
And again, baby
hippopotamus.
Beautiful.
Baby hippopotamus.
Arms up for me. Turn them up like you're holding the tray. Good. Close your eyes. Fabulous. And pop them down. And can you do this finger at the moment? Yep, onto your nose. Back up to my finger. Nose, finger, nose, finger. Excellent. You're just trying to give us all a heart attack. You're looking really good. There's no bleeding in the scan.
Yeah.
It's probably that your blood pressure dropped a little bit too much, so we're just going to have a little bit of a balancing act over the next little while.
When his wife Frances arrives, Bruce is keen to talk things down.
There you are.
Yes, yeah.
You've given us a scare.
You didn't have to come. I told you, darling, not to come anyway. You could have stayed at work. That's no big deal. That's
Miss all
okay.
this?
It's a small stroke. That's small. I can even talk better now. As my blood pressure goes up, I talk better. When it goes down to what yours like, I can't talk.
Except he keeps trying to talk even though he can't talk properly.
Yes, I can't. Yes. I can talk better right now, actually. Best I've been. What's that thingy I say?
The blood pressure.
Yeah.
Oh, baby hippopotamus.
Baby hippopotamus. Yeah, I can say a lot
Look
better
at
than I
that.
could before.
Oh, is that your test word?
It is.
That is.
Baby-
One of them. Yeah, baby hippopotamus.
He couldn't
Baby
really say it at all the
And
first
that's my
time.
hand. It's got the thing on it, and it's weak as hell. I can't even. Oh, you know, that's the one that went off. I couldn't. You know, the banana you gave me. I couldn't peel. I tried to peel. I couldn't peel the bloody thing. I peeled one side of it, and it started to get worse and weaker. I thought, this is shit. What a shit banana. Then I thought it was me, and then I couldn't talk, so I called the ambulance. They come and got me.
Well, you've saved your own life, haven't
Yeah,
you?
last time I
Because
caught him,
you
and she
knew
yelled
this,
at me.
you knew the symptoms to call the ambulance.
Yeah, last time
I
you
try
yelled
and
at me
give him
before,
a
I
banana
shut up.
every day
Oh,
because
do you?
it's good for all the fruit and vegetables that's in a banana.
Well,
But
it
he
worked
doesn't
wonders
like them.
today.
Yeah.
Bananas saved your life. I'm going to call you B1.
Yeah, okay.